The burden of substance use disorders in America, who are truly affected. A Narcan distribution program presented by Laura Gonzalez, Erica Finaro, and our program is based in the Chicago area and aims to establish the Chicago Public Library citywide overdose prevention program in 81 CPL locations through a collaborative effort between Chicago Department of Public Health and Chicago Public Libraries. This program looks to make Narcan nasal sprays available for free in 81 CPL locations throughout the city to prevent fatal opioid overdose. Key components of our innovation are to provide harm reduction care in the communities, to provide Narcan for distribution freely to community members, and appropriately train library staff and community members about use of Narcan and enhance the skills and abilities of administration of Narcan to prevent fatal opioid overdose.
On this slide, we talk about the logic model of the program. So on the input section, we see cross-sector collaboration from healthcare workers and institutions, EMS providers, the Department of Public Health, libraries and state administration officials, and manufacturers. We'll also see harm reduction methods, evidence-based research, overdose treatment, marketing, funding, and equity data related to opioid overdose and Narcan training curriculums. In the section of activities, we go more in depth into the CDPH collaboration with the CPLs and how those officials discuss Narcan distribution programs. We also talk about how they convene together to make these discussions and start the collaboration in itself. We see how the CDPH gathers Narcan kits to provide to those CPLs that they've already selected. We also see how the CDPH works with the CPLs to train the library staff on opioid overdose symptoms and Narcan application. We'll also see how CPLs offer education about opioids and teach the community how to apply Narcan. We'll also see CPL evening tutorials on how to use Narcan, what is an overdose, and how community members can access Narcan 24/7 to intervene and reverse overdose death and increase the distribution of Narcan throughout the communities that were involving the 81 CPLs. In the participation section, we move on to see the 81 CPLs that sign on to participate in the Chicago Public Library Narcan program. We'll see the distribution centers that have been established, the number of Narcan kits that are distributed, the thousands of employees that will be trained, over 100 community training seminars that are being held at these CPLs. And CPLs will now start to begin to promote and advertise Narcan availability within their locations, making it kind of like a safe haven for people that are opioid use, opioid drug abusers, and anyone that has suffered previously from opioid overdose, or families that know of people that have suffered from opioid overdose. We'll also see the promotion of the 81 CPLs that are validated for Narcan distribution. And you'll also see some local media and news segments that explain the program and the centers that offer these services. Short-term outcomes that we intend to see or have seen are an increased recognition of opioid-related overdose, increased community awareness of Narcan, increased community skills of use of Narcan, and increased knowledge of opioid overdose needs and the use of Narcan by library staff. Some intermediate outcomes that we expect to see are the increase in people immediately using Narcan as soon as opioid-related overdose is detected, increasing the community awareness of Narcan instruction and use, not only just among people that are opioid users or just the general public. So that way, if they do identify someone suffering from some type of overdose, they can also act immediately. We'll also see an increase of Narcan among all families, like I've already mentioned, regardless of substance use disorders within the families. Long-term outcomes that we expect to see are the reduction of opioid-related deaths among African Americans specifically, because most of these CPLs are located in African American predominant communities. We also expect to see an increase in number of overall people that use Narcan, decreasing disparities in reference to access to opioid-related abuse, help, and equal access and opportunity to life-saving medications for all populations, regardless of gender, ethnicity, or mental illness or health illness that they may be suffering from.
Evaluation efforts. So here we have a table that states our evaluation questions, designs, methods, and data from the previous weeks that we have all worked on for this program. So for Laura's, we have how effective was the collaboration between the Chicago Department of Public Health and Chicago Public Library in creating Narcan distribution centers. And for the design, we have processed evaluation. And for the methods, one group post-test questionnaire. Other programs that showed successful collaborations would be used to determine gold standards. And then for the data, each member of the program planning committee will be given access to an online questionnaire to respond in depth to. The answers of the survey would be compared to the predetermined gold standards. For Erica, her question is, to what extent did the program change the skills of Narcan use by the Chicago Public Library community members? And for the design, she has selected multiple group time series. And for the methods, pre and post-test projects for comparison group and the sites. And questionnaires and observations will also be conducted. And then regarding the data, give the CG and CPL distribution sites the pre and post intervention survey. The CG will receive it via the website only, and the CPL distribution sites will receive it by both website and paper copy. We will conduct the questionnaire and interviews twice for each site and the CG. And then for my question, I stated, how has the program affected the community's ability to recognize the signs and symptoms of an opioid overdose occurrence? And the design I chose is a multiple group time series. And for the methods, I've selected observation surveys and polls with the utilization of other existing surveys regarding similar programs. And I will also be assessing focus groups. And regarding my data, structured surveys will be distributed at the sites to assess attitudes and perceptions of the community. Focus groups typically include 6 to 10 persons discussing a specific topic for 1 to 2 hours. An interview guide, similar to what is used with semi-structured individual interviews, will also be assessed.
For our first question, we focused on the activity section. And the question basically planted is, how effective was the collaboration between the Chicago Department of Public Health and Chicago Public Libraries in creating a Narcan distribution center? The evaluation design selected is the processed evaluation. And the reason that we selected a processed evaluation is because it will provide some insight into the socio-ecological obstacles that could potentially hinder the continuance and expansion of this project or even future projects that will involve libraries utilizing Narcan in their locations and even potentially expanding to other public areas for Narcan availability. This will evaluate the collaboration between these two sectors and understand how can we optimize this collaboration to effectively distribute more Narcan and expand this program into other locations, not just pertaining to the Chicago Public Libraries, but also, like I previously said, other public spaces. Understanding this base method will allow us to evaluate the program at its different intersections that can equally impact the program negotiation process and provide essential knowledge on how to maneuver through the challenges of politics and healthcare from a separate and combined setting perspective. With this, we are expecting to provide some insight into the effectiveness of cross-sector collaboration and future programs, and open the doors for other potential health initiatives. Data collection for the quantitative and qualitative evaluation of this question will be done through a one-group post-test analysis. We will use post-intervention questionnaires that are online surveys that are also online, and interviews that can either be through Zoom or in person. The stakeholders that we're expecting to see predominantly in this question evaluation is the principal investigators, who will then publish research that is in renowned journals to help disseminate this information and increase Narcan awareness, and involve cross-sector collaborations on Narcan availability. Chicago Public Libraries will also offer a safe learning space and Narcan dispensary. Chicago Department of Public Health will distribute most of the Narcan in itself, offer health education, and potentially even extend their network across the communities. And community officials and policymakers will create new local laws that can impact what is opioid use disorders and people suffering from them, and the effect of opioid overdose death rates in what is the city of Chicago.
For our second evaluation question, we will look at the short-term outcome around skills and abilities. This evaluating question is, to what extent did the program change the skills of Narcan use by CPL community members? This evaluation will be done as a multiple group time series. We've chosen to use this approach for two reasons. One, because we want the findings of our program to be useful for implementation of similar programs across the nation in the future. And second, because we are specifically evaluating skills. We have to be able to show a change in the behavior in the group of people. Comparing a control group that does not have a similar program in place, however, does have a similar fatal opioid overdose rate, will help to highlight the effective components of our program. Since our given focus for evaluation question 2 is on abilities, it's essential for us to not only record the participants' prior knowledge before our information sessions, but also their behavior throughout the sessions and their subsequent recall. Employing a hybrid methodology will enable us to do this task and evaluate any advancements or improvements in skills. Observations can be encoded and utilized as a reference for evaluating the written response in the subsequent questionnaire. Data collection will include both quantitative and qualitative measures. Quantitative evaluation will be conducted using pre- and post-testing methods, which will include a control group. Every group will receive an identical pre- and post-test administered 6 months after establishment of the CPL in their respective location, employing a control group derived from a comparable location. The control group will be chosen by identifying a place in the country with a similar opioid overdose death rate, but without a Narcan library distribution facility. This will enable us to assess the extent of change after 6 months of operation for the CPL distribution sites. Community members are invited to attend informative sessions and will collect data on established proficiencies in administering Narcan within these regions. For instance, what is the popular utilization or the proper utilization of Narcan? Is Narcan harmful to either the recipient or the person providing it? What are the recommended actions following the administration of Narcan? How do you administer Narcan? Methodology and data for qualitative evaluation will be a hybrid approach, including observation, data collection, and written open-ended inquiries. Monitoring of a community members prior to, during, and subsequent to informative sessions. Our collection process will document the comprehension of skills through observations derived from the information session processes. These records will aid in comprehending the written responses to the post-survey. This data will be delivered in different ways to different key stakeholders. It will be compiled and published into manuscripts for future researchers. It will be made into marketing materials and media segments for community members and impact measures for Chicago public health administrators and policymakers.
Evaluation question 3, and this is an intermediate outcome. How has the program affected the community's ability to recognize the signs and symptoms of an opioid overdose occurrence? So the evaluation design that I will be utilizing for my question is a multiple group time series design. And this is because these type of designs refer to the use of more than one set of data that was collected over a period of time, as in accident rates over time in several states or cities, so that the comparison can be made. These designs are typically used in psychology to study changes in behavior and other variables over time, and usually involve collecting multiple measurements of behavior or other variables. This design would best fit my question because it can fully assess the program through post and pre-testing methods. Some examples of how this design is used are treatment evaluation, developmental studies, and program evaluation, which is very fitting for, of course, the program that we have here. Evaluation question 3, data collection and stakeholder dissemination. So for the data collection, I chose observations, surveys, and polls for my quantitative evaluation method. I also will utilize other existing surveys that are online regarding similar programs, just to use that information to compare with our program's results and outcomes, and essentially have the first trial of surveys go. So that will be important to utilize, of course, in this program. For my qualitative evaluation method, I've just gone with focus groups. There is a lot of evidence and research that shows how focus groups are great when making comparisons and measuring knowledge intake and perceptions of knowledge. And so for my question, that's very important because I need to know whether or not the community has gotten the ability to recognize these signs and symptoms, and using focus groups would really help establish that. For stakeholders, I utilized 4 different stakeholders similar to Laura and Erica's, which is going to be health researchers, policymakers and officials, Chicago Public Library, of course, and Chicago Department of Public Health. Chicago Public Library and Chicago Department of Public Health are 2 key essential stakeholders in this program, of course, as we are using their libraries for our environment of this program, and that's very important. So that would be 2 vital stakeholders, I would say. For health researchers and policymakers and officials, those are also 2 important stakeholders needed because they can publish research in the media, which not only helps spread awareness, but can help other different types of programs that are studying similar subjects, such as opioid overdoses. And then for policymakers, they can help implement new laws and standards and sets of criteria that will be used to basically evaluate other different type of programs that might coexist with ours. So these 4 stakeholders are crucial, along with the different types of data collection we have here, quantitative and qualitative.
And here are our references. Thank you for listening.